Hello and welcome to The Vaccine. I'm Jeremy Fernandez. The COVID-19 outbreak in the Northern Territory is being described as scary. Health workers are worried Indigenous communities are extremely vulnerable to the virus because of overcrowding, a lack of services and the low vaccination rate. At the same time, case numbers are surging in Europe as they head into winter. More on that in a moment. But first, ABC reporter Kate Ashton is in Katherine and she joins us now. Kate, what do we know about the origins of this outbreak?
So Jeremy, now what we know is that this outbreak is linked to an earlier outbreak in the Territory that was sparked by a 21-year-old woman who lied on her border entry form. She'd entered the Territory via Queensland, but she'd actually spent time in Victoria before that and eventually tested positive. What is still very confusing is there's quite a significant gap between this outbreak and that previous outbreak caused by the traveller. So there's a 9-day gap where there was no known cases before new cases were tested positive here in the community in Katherine and eventually spread to the remote community of Robinson River.
So is it clear yet how far this has spread?
So far, the only positive cases that we know about are here in Katherine and in Robinson River, but there are concerns about the potential for it to spread to the rest of the Territory. Today, for instance, we heard that there's been a positive wastewater result in a small community just on the outskirts of Katherine called Binjari. So there's been no positive cases there yet that we know about, but obviously it is a concern. Crew are going in and testing everyone in the community today and encouraging them to get vaccinated. We also heard in the press conference today that close contacts have been identified as far away as Yuendamu, which is a central Australian community, and Tennant Creek, which is hundreds of kilometres down the highway from here. So there is certainly concern that it could have spread elsewhere in the Territory in that time.
Now, among the latest cases, a fully vaccinated health worker has tested positive. How concerned are the authorities about this particular case?
Yeah, it's obviously really disarming to hear one of the 2 cases today was in fact an Indigenous health worker. He's now been taken to hospital. Obviously in the community here in Katherine, they're relying on their health workers to help them through this pandemic. It's the first known case of COVID in a health worker in the Territory. It's really concerning, and the fact that, he's having to go to hospital, a concern as well. There's only one other person who's been hospitalised at the moment from this outbreak. We understand she's in a serious condition, but she's not in ICU, so...
Tell us about the number of exposure sites there, because it seems that a lot of people are turning out for testing. They are concerned.
That's right. So there's been really good testing numbers in Katherine over the past couple of days. Numbers thereabouts the 700 mark for the past 2 days, which is basically more than 3% of the town's population. It's because the exposure sites have been very public. So the Aboriginal Health Clinic, as I mentioned, the hospital is an exposure site, and the town's Woolworths, which is widely understood to be one of the busiest supermarkets in the country. It's a place that obviously everyone goes. It's the only major supermarket, a casual exposure site several times. So that's sort of what we've been seeing with the huge testing numbers and long testing lines. Although I may add today the testing lines are looking a little bit quieter. So it's possible a lot of those early casual and contacts are beginning to get their results back and get out of isolation.
Kate Ashton in Katherine, thanks so much. Let's speak now with community member Maddie Bauer. She joins us live now. Maddie, what is it like in Katherine right now?
Hi, Jeremy. Thank you. It's a bit quiet on the street the last I went down there. There is some vulnerability still within our community.
What are the biggest challenges there that you see?
I think the information getting out to communities and really building on the trust of the communities and the relationships. As much as we think in the lay terms and the lay community, we think we have a really good trust with communities, we still have a bit of work to do. I think we have to take on the historical circumstances there. If we don't have the trust and relationships with the community and our local Aboriginal communities especially, people aren't going to listen. So I think it goes back to misinformation that's been taken to people. I've had some elders that have talked to me about particular instances, and they're not really trusting the government as such, and our health systems. So again, taking our historical systems in place, especially where the health is concerned.
First Nations people were among the first who were part of that rollout, the vaccination rollout, and yet around the country now we're seeing Aboriginal people under-vaccinated compared to the rest of the population. How prepared was the community in Katherine for this eventuality?
I think we became a bit complacent, and we could have done things a bit more earlier in the year, and to really strengthen that with our health information coming from the right sectors, and really going out to communities and actually making sure that we get that information as well. I think it leads into the vulnerability of our Indigenous nations, as well as homeless, aged care and people with disabilities. We have to really strengthen our knowledge to really get out there and pass that information on, but also have people that are trusted and have those relationships already to work with health services or health sectors or anyone that goes to community to give vaccines. I think that's a given, I would think, but it doesn't always necessarily work like that.
Maddie Bauer, thank you for joining us.
You're welcome.
Let's turn our attention to Europe now, because as winter sets in there, lockdowns are back on again. Case numbers are surging and hospitals are being overwhelmed. Many of those getting caught up are the unvaccinated, who are passing on the disease and getting sick themselves. Casey Briggs takes a look.
This nasty COVID wave is spreading across more and more of Europe. As winter approaches, we're seeing cases and, unfortunately, deaths too, climbing across much of the west of the continent, which, generally speaking, has quite healthy vaccine coverage. But still, Greece, now, amid a spike in deaths, reimposing rules for unvaccinated people. Austria's gone back into a partial lockdown with its spike in deaths, and Germany too has reimposed restrictions. These are the vaccination rates for these three countries. It's between 60 and 70% of the total population in all three of those countries. Australia, by the way, is actually even higher at the moment. But in these Western European countries, like much of the continent, that surge in vaccinations that we saw, the rapid growth in coverage, well, it began about 6 months ago. So could it be that we're now beginning to see the effect of waning vaccine immunity, like we've seen previously in countries like Israel? Western Europe's not the place a lot of these waves started. We actually saw much faster growth and earlier outbreaks in Eastern Europe, where, countries like Romania, like Bulgaria and Latvia, cases starting to rise in those three countries in as far back as September or even August. And they're now all countries that are recording record numbers of COVID-19 deaths. And frankly, the vaccination coverage in those countries is comparatively quite low. They've been growing in the last month or so amid these outbreaks, but at the moment 24% of people in Bulgaria are fully vaccinated, 36% in Romania, and Latvia's just cracked 60%, but at the start of October it was down as low as 46%. And this is probably part of the reason we're seeing across the entire continent this massive spike in both infections. Cases across the continent have hit a new high watermark. The 7-day average is higher than it's ever been through this entire pandemic. And deaths too. Daily deaths on average are now pushing up toward the number 4,000 every single day. And that is just about as bad as it was right back at the beginning of the pandemic in that first COVID wave.
So it's becoming clear that Europe is now facing a triple whammy of poor vaccination rates, waning immunity and the winter cold in its latest COVID surge. Professor Eva Schenhammer is the head of epidemiology at the Medical University of Vienna in Austria, one of the worst affected countries. She's currently teaching in the US and joins us from Boston. Professor Schenhammer, thank you for joining us.
More than happy.
Can you pinpoint the reasons why this surge is happening?
Number one is the Delta variant. We have seen this already in the spring in Europe with this last wave that really directly was related to the doubling of infectiousness of the Delta variant. And that has created the latest wave before the vaccine was finally applied. And we were hoping that with the vaccine, we would be able to combat this efficiently. But it turns out there are two important factors with the vaccine. One is that you really have to have vaccinated with this Delta variant now a relatively high proportion in your population. Maybe hard to achieve, but I think if you're below 80%, factor that we are experiencing right now, and where Israel was a little bit before us in the summer, and we could have perhaps paid more attention to this, is the waning of immunity with these vaccines, which is pretty drastic. If you don't get a third booster shot, it seems like that people are losing quite a bit of their immunity even after 2 vaccines. And this is this time frame of 4 to 6 months where you start seeing that waning of immunity. And, in Austria, those 4 to 6 months are right now. So it's a collusion of different things, low vaccination rate, exactly now when the winter comes, losing the benefit of the warmer weather. We also have the waning immunity. In my view, though, that's like a triple whammy that's sort of creating the current uptick that we see.
So as a result of that, how great is the burden on the hospital system?
The burden is already maximal. This is really impressive now. The healthcare workers are going to the street saying they can't do it anymore. The intensive care units are full. These guys have been working through since 2 years, and now it's getting even worse. There are a lot of personnel in the hospitals that are sick themselves, and surrounding personnel has to do quarantine if it's COVID-19 that made them ill. So there is a lot of issues surrounding the personnel at the hospital and also the capacity of the hospitals. And the fear is that this is going to impact now everyone in the population, because if, say, you have an accident or myocardial infarction, there will not be room to be treated in the hospital anymore. So it's starting to really pull us all into this big problem here. And I think it's the number one issue right now to kind of bring this high infection rates down to get some relief to the hospitals.
A lot of people who are ending up in hospital are the unvaccinated, and some countries are starting to lock down those people who are unvaccinated. The World Health Organization is among those who are saying this is a challenge to civil liberties and human rights. It's a tricky dilemma, isn't it?
Yeah, it is true. In Austria too, at the moment there are at least 2/3 of the patients, or even more, that have to be treated in intensive care units are unvaccinated. They end up having really severe courses of the disease if they get sick with COVID-19. So is it ethical to restrict their movements in order to try to relieve the current high case numbers? That's an interesting question, I think you do have to take steps. And we know exactly that these steps have to be to an extent that we bring down probably around 1/3 of the movement in Austria to get the relief we need on the case numbers. So you could start with the unvaccinated, but if that doesn't work out, and honestly, it looks right now that these measures may not be sufficient, because I don't know whether you realize, but in Austria already 10 days ago, a 2G rule was implemented, meaning that unvaccinated couldn't go to entertainments at night, restaurants, theaters. They needed to show vaccination proof. So essentially, they were already excluded from these types of activities since 10 days. And yet the case numbers aren't coming down. So it looks as if this won't have the impact that everybody is hoping for.
So considering that vaccination rates have for the most part stalled, what's the best way to get it moving again?
There was hope that one could persuade those who are unvaccinated to do the right thing and to get the vaccine, and thereby help the entire country and our society. But that hasn't happened. So now, at this moment, there are voices getting louder talking about vaccine mandates, and that one should consider that option too, to kind of get to the point where we can be sure that we are not, even after a short lockdown that may help for the moment, soon after that get into another wave, because the unvaccinated rate is still so high and would allow that to happen. So vaccine mandates is one option, or as is currently done, just making the life of unvaccinated so unpleasant that indirectly some of them may think, rather than having to deal with this, I get my vaccine and get it over with. And that's also working. So you do see we have fourfold more higher numbers of first vaccines these days. But still, how long this lasts and whether it will not stop anytime soon, that's unclear at the moment. So,
Professor Schanhammer, great to have your analysis. Thanks so much for joining us.
It was my pleasure.
And that is the show for this week. Thanks for your company. From all of us, bye for now.